For our Common Ailment podcast, we were assigned the muscular system, and the ailment that we decided to talk about is muscle cramps. Throughout our brief studies, this is what we found.
Muscle cramp, also known as a muscle spasm, is a sudden and involuntary contraction of one or more of your muscles. A muscle cramp is often painful and can last from a few seconds to a few minutes, and can cause immobility of the affected muscle. They also tend to come without any warning. A cramp usually goes away on its own after several seconds or minutes of cramping, and most cramps happen during rest, usually at night while our body is the most relaxed. They are also often associated with pregnancy, physical exercise, overexertion, or age. In such cases, cramps are called idiopathic because there is no underlying pathology. In addition to those benign conditions, cramps are also associated with many pathologic conditions. All muscle can cramp, but the muscle of the calf, back of thigh, and front of thigh are most often affected. Cramps are also common in the feet, hands, arms, and abdomen.
Some of the causes for muscle cramps, according to medlineplus.gov, are overusing or exhausting a muscle during exercise or physical activity, aging due to losing muscle mass, dehydration, having a thyroid gland that is less active than normal, aka hypothyroidism, taking certain medications such as statins, which are used to treat high cholesterol, not enough blood getting to your muscles or having bad circulation, compression of the nerves, an example of this would be carpal tunnel, low levels of electrolytes such as magnesium, potassium, or calcium, for example, dehydration or losing fluids through vomiting or sweating.
Some of the treatments we found for muscle cramps include the application of heat and or cold towels works well for minor cramps, and if needed, it is recommended to take a non-steroidal anti-inflammatory drug such as ibuprofen or Tylenol. Taking a warm bath or directing the steam of a hot shower onto the cramped muscle can also help. According to the Mayo Clinic, gently stretching the muscle can help relax it as well as massaging the affected muscle. For example, when I wake up from muscle cramps in the night, I have found that flexing my foot up towards my body and slowly massaging the cramped muscle usually helps to get rid of the cramp the fastest.
Other treatments that we found to prevent muscle cramps include simple things such as drinking more water and including more potassium, calcium, and magnesium in your diet can help you avoid muscle cramps in the future, as well as taking vitamin B12. An alternative form of treatment that has been backed by the Cooper Institute is drinking pickle juice. While it isn't an instant solution to stopping cramps from happening, it will help reduce the length of serious cramps. Other ways to help ease muscle cramps include moving the cramped muscle. This movement causes the body to send a signal to the muscle that it needs to stop contracting and relax to function normally in its movement.
In conclusion, everyone is susceptible to muscle cramps, but they are most likely to affect those who are athletes, pregnant women, and middle-aged individuals. They typically are caused by dehydration, overexertion, muscle strain, and many more. Some of the most helpful treatments include flexing and massaging the cramped muscle, including more water, potassium and calcium into your diet, and applying some form of heat, whether that be through a warm bath, a heated towel, or steam.